could say he did that, but you know. But so gosh, is change hard? Oh, heavens, yeah, it's really hard. But it's not impossible, and we must never think that it is, or we won't be able to do it. It's just that simple. Very simple and very complicated concept. So I wanted to share that with you just so that you knew that change can be done. Design can make a change, can make a difference, and so we need to leverage all of our skills here today to try and figure out how to make some difference in a system. I would say most healthcare systems are broken. I just came back from India. Man, if you think they do lots with limited resources there, it is the most amazing piece to see. Amazing. I was at a public hospital that is a 1,000-bed hospital that runs at triple capacity all the time. And they manage to get pretty good patient outcomes. I think we have a lot to learn from them, all of us. So I wanted to share with you what I do at Ellerbe and some ways that you can actually think about doing research in your own hospitals to sort of look at what works and what doesn't. Because you can have the greatest ideas in the world, like the piano stairs. Of course, as the researcher in me said, I wonder if those statistics would stand for longitudinally, like so in a month, in 6 months, and so, but you have to know those things, because then you can adapt and adjust. That's what it's about. So we do, well, we actually don't do this kind of research. I do have a research partner, and we do have dogs, but we actually do not submit them to any kind of unethical treatment. So that is not the kind of research that we do, but we do something similar to this. So we look at, in the center of it is what we call a healing environment. We could call it an optimal healing environment. And we look at ways that these kinds of things in the designed environment affect outcomes, like Sam was talking about, and how they affect and impact the healing environment. I'm going to give you some examples of that. I really like this graphic, though, because it's very holistic, and we try to use a very holistic approach. And again, I think both of you sort of touched on this, so the researchers of the past, and we're not talking about clinical research here. I'm not talking about isolating things in petri dishes and people in rooms. My dogs would never have that. So we have to study people and animals in their natural settings, because otherwise we don't understand how they behave. So the researchers of the future are interdisciplinary teams, exactly what you were talking about, Luigi, which is bringing people together with a lot of different perspectives of the same problem, children included in that, and we want to understand how something impacts them. So I'm going to show you some ways that we do that. So we use research to capture voices. So this is what we call the visual listening exercise. So we had this really great idea for a hospital, children's hospital design. The client hired us because of our great idea. And we started working with the nurses and the administration, and we even had family representation, because children are family. Children, the lotus is the children and family, so the patient is a family unit. And we had family members, and then we had all this wonderful ideas about their experiences, and then somebody went, well, what do you think the kids think? And we went, well, they're vulnerable populations in research. We can't go near them. So we found a way around that.